Our second speaker for the session is Dr. Monica Lousbury, who is currently serving, recently hired as Dean of the College of Health and Human Services at California State University in Long Beach. In a way, last night's keynote speaker was a terrific warm-up act for Monica's talk today, and I don't think you'll find a better person in the room here today who can speak to the topic of her paper or presentation, which is School Physical Activity, Policy Matters. Please welcome Dr. Monica Lousbury.
Thank you so much. Well, it's certainly my pleasure to be here to talk in front of such an esteemed group of scholars in the field about a topic that is so important to me. I have 3 points I want to hit in this topic, or in this talk today. First, I think it's really important to understand that school physical activity policy research really came out of a public health need to address physical inactivity. I want to go over that, and I want to explain why schools and why school physical activity policy matters. I want to talk about the matters of policy just to help us understand what's being researched, what are the intricacies of policy, and then tell you a little bit about some of the research that's going on in this field. And by the way, school physical activity policy is a pretty new area of research, so there's lots of invitation for developing new researchers to join that venture. Then I want to really link policy and advocacy. I think some of the questions that I heard last night were related to advocacy, and I want to talk about where there's opportunities for research and understanding advocacy. So first of all, as I promised, I think everybody knows that physical inactivity is a global health problem, and it is leading, it's the fourth leading cause in mortality globally. And what's interesting about it is that it affects everyone, and it makes it really clear that it's a very complex problem. So really, what are we doing? We've known for a while that physical inactivity is a problem, but the question really is, what are we doing about it? Because the latest YRBSS data is showing that 27% of youth, and the BRFSS data is showing 21% of adults meet physical activity guidelines. Not so great, right? So Jim Salas has really provided a little bit of introspection of what we've really done to improve physical activity. And his points are that we've made minor investments in programs, and those investments have been interventions have been guided by theories that emphasize psychological and social influences, and the primary goals are education and behavior change skills, and these efforts have been largely fragmented and poorly funded approaches. And so the question really is, how can we help make physical activity the easy choice, especially where people are spending the most amount of time? And so there's growing interest in really working in the arena of the physical environment and policy context, in addition to the social, cultural, and the individual sets of strategies that we can use to try to motivate behavior change. And the idea really is that if we make investments in changing the physical environment and the policy context, we might have a higher degree of potential for sustainability. And so if we think about children, we have to think about what environments do they spend most time in. Well, school is a great place to start for us because kids are there for about 13 years for about 6 hours a day for 9 months of the year. And that's a great way for us to begin to think about how we can promote and provide physical activity from this public health standpoint. But I think all of us in the room know that schools have some challenges relative to the physical activity that's been happening there for such a long time. Though physical education and recess are institutionalized programs in schools, they've experienced enormous reductions. So today, the latest SHIPS report shows us that less than 5% of schools at any level provide daily physical or require daily physical education. And even when it's provided, it doesn't mean that it's actually being, or even when it's scheduled, it doesn't mean it's actually being provided, because as many as 30% of classes are canceled when in fact we're having physical education. And we have good data to suggest that when kids are not provided with physical education, they have a reduction. They have that physical education has a good contribution to physical activity. And so when kids don't get physical activity, we see, or physical education, we see physical activity decline. And this is true for recess time as well. And so we can see that we've had lots of decreases in this amount in the time that kids have for free time, decreased time for play, decreased time for unstructured outdoor activity in schools. And there's disparities for low-income kids and disparities for minority children. And so this is where the key to policies really comes into play. So why school policies? Policies really are integral to the structure and function of what happens in schools. And it's really important to understand that policies target practices. And a lot of the things that I just talked about, like whether or not physical education is scheduled and how long it's scheduled for, those are practices. And when we have policies in place, they're targeting changes in those practices. Now, why would we want to do that? Because if we can increase those practices that allow more opportunities for physical activity, they're going to create opportunities for kids to be more active, and hence they will be more active in schools. So a policy example that I provided here, just to get the nuances of the differences between policies and practices, a school or a school district or a state may have a policy that students are required to receive 150 minutes of physical education per week. And to look at whether or not that policy is being implemented, we might see these practice examples. That PE is scheduled for 150 minutes per week for every class, and it isn't withheld for academic or disciplinary reasons, and it's never or rarely canceled. But physical activity policies are complex because there are a lot of levels of policy. We have state levels, district level, school level, and class level, and there are a lot of policy makers or policy-making bodies. And policies can come from all of these different places, which makes it very complex to understand where to focus our efforts if we are interested in changing the practices that happen in schools. So it's interesting to note that at the state, these are the major actors for policymakers: the governor, the legislature, the superintendent of the schools, Board of Education, and Department of Education. At the district level, we have a school board, a superintendent, and a curriculum director. Oftentimes, physical education doesn't have its own curriculum director, but may have a curriculum director that has multiple subjects under their supervision. And in schools, the major policymaker is the principal. And even at the class level, teachers make policies that govern what happens there. And so if we get the gist of what people are actually studying, it's study of the evaluation of the policy structure of physical activity practices in schools. And so in most of this research, the independent variable is policies or policy characteristics, and dependent variables are the school practices. And so some of the characteristics that are currently being studied are looking at policy adoption and the level of that adoption, and trying to understand the predictors of enactment of policies, and or also looking at the degree of implementation for policies. And we're also looking at the language of policies. How specific is the language of policies, and what kind of language do they have? Is it weak language that is an encouraging kind of language, or is it strong language that says it's required? And researchers are associating these characteristics with school practices that are in place in schools, and really trying to understand how it has implications for physical activity. And so one of the challenges, though, with existing research is that oftentimes both policies and practices are being reported from state or school district officials who are distal respondents from the school, and they likely don't have knowledge of specific day-to-day physical activity practices. And just to illustrate a challenge with this, in one of our studies where we had 154 elementary schools from 34 states, we asked the question of principal and teacher pairs from those same schools: does your physical education program use a specific curriculum? And 86% of the principals said that they did, and 33% of the teachers said they did. So this is where even the principal who is in the school building doesn't probably know very much about the physical activity practices that are happening in their school. This is a challenge for us if we want to operate on the physical activity practices in schools, that the school leader doesn't necessarily know what's happening there. So the advised methodology really is that school site data sources should incorporate the use of mixed methodologies and specifically interviews with those who deliver PA programs, like the physical education teacher. Direct observation of physical activity programs are advised, and getting school records like schedules, fitness test results are important. We also, I think, need to use reliable and validated instrumentation, and myself and some colleagues, including Dr. Morrow and Dr. McKenzie, who are here, developed a tool called the SPAPA. It's a School Physical Activity Policies Assessment Tool. There are 3 modules, and there are 47 items for physical education. This assesses both physical activity, or the physical activity policy, and the practices. So what's nice about this is there's a list of practices and a list of policy areas. One thing about the SPAPA is that if you use it to try to understand the strength of policy, then you really need to collect the actual policy itself and understand the language that's in it to try to understand the implementation from the practices listed. But we also need to develop better tools to assess the complexity of implementation, because as I'm going to show you in a minute, the research here is very, very, it's telling us that policies have an association with multiple practices and sometimes not the ones that we think that they will. So I'll show you that in a minute. So here's just some summary of the research that's going on. The typical study aims are to describe enacted policies and to associate those policies to school practices or estimates of children's physical activity. And here's what we know. Most policies exist at the district level, and most of them relate to physical education. And we think that's because physical education is part of the regular school curriculum and it's institutionalized in schools. But policies have multiple practice associations, and we don't really understand those associations all that well yet. And PE policies are associated with other PA policies and other PA practices. So one thing that I find interesting, just to get into the weeds a little bit from one of our studies, when we look at the time allocation of PE and recess, the practice of how many minutes are scheduled for physical education and recess, we find few association between PE policy and PE or recess time, but we find more for recess time, even though we're talking primarily about PE policies. And interestingly enough, predictors of PE time, these are the policies that we have found have important implication. A school policy for annual program evaluation and for fitness testing. And if you look at these two policies, you're really understanding this is at least implicit requirement for some kind of outcome expectation for physical education. And so we think this is really important. Sadly enough, not very many schools have this policy in place. We don't evaluate the curriculum for a particular outcome. So this is a challenge for us, and we certainly need to learn more. PE predictors for recess time, or PE policy predictors for recess time, there's really interesting district policy requiring specific number of PE minutes per days per week, and school policy requiring specific PE standards or guidelines. And PE and recess really appear in our studies to compete for time. Schools are either investing in one or the other, or not both, but not both. And we think that there are more logistical barriers to providing physical education, typically because there are staff requirements to hire someone, perhaps we hope, a certified physical education teacher. But in elementary schools, we typically afford one, and if we're lucky, two. And so all of the classes have to matriculate through. So it's not possible for students to have necessarily daily physical education under that dynamic. So this is challenging. But we believe PE policies are really critical because they appear to have so many different associations across more than just physical education practices. So they might shape a generalized school value for physical activity. important to know. So the relationship between policies and practices is very complex, and in many cases, implementation is poor. And we think partly it's because policies aren't necessarily disseminated very well, which I'll talk about in a moment. And there may be, we hear lots of reports. We have lots of reports from school administrators who tell us that there's a lack of time resources and there's a lack of funding resources to really implement the policies that are in place. And some policies may be more salient than others. Like I talked about the outcome policies. That might be something where we really think about, if we want to motivate some changes, having outcome expectations for physical education might be a good place to start. And some evidence indicates that having multiple PA practices in place results in greater physical activity, kind of like the comprehensive school physical activity programs, but also whole of school approaches as advocated by the IOM. So implementation is complex. I said I was going to get back to that. So the school environment and the practice indicators are difficult because it's not just a singular kind of thing. We're really identifying that there may be primary, secondary, or tertiary indicators of how well a policy is being implemented. There needs to be much more work in this area to help us identify that. We need to develop interventions to improve policy implementation, but in order to do that, we have to know a lot more about policy dissemination. Who are the people who are disseminating the policies? We'll refer to those as actors. Who are the targets for that dissemination? How often is that done? And what are the methods that are being used? And two, that there might be some really important internal factors to consider, like community demographics, political frame, and et cetera. So now I want to shift my comments to advocacy. So, I think all of us recognize that there are some real challenges, I think, facing us in schools right now. And we have numerous barriers, including curricular time, allocations, low subject status, inadequate resources that hinder physical education from playing a major role in promoting and providing physical activity. So Tom and I wrote this paper to primarily a journal that is read by physicians, and this was in the Journal of Lifestyle Medicine, to try to understand why physical education isn't quite poised to really contribute very largely to public health goals because of some of these challenges. And so advocacy is really needed under these circumstances. I think all of us are recognizing what can we really do to motivate changes that we can actually adopt better policies that are strong and have important implication for changing the practices in schools. So it's important to talk about what advocacy is. Advocacy is promoting a cause. Our cause is, of course, trying to provide better practices in schools that lead to better physical activity outcomes for kids, but it's through influencing others. And so this is really important. Others means those that we need to enlist in the cause. We have to identify those people, and depending on the policymaker that we want to target, they're different. Those folks are different. And those who can actualize the change, these are the policymakers. Now, I want to talk a little bit about federal versus state and local efforts. It's so critical to understand that school and what happens in public education really is largely a state and local responsibility, because 92% of the funds for public education come from there, and only about 8% of the funds come from federal sources. And while we have tools like the Elementary and Secondary Education Act that certainly provide us with opportunities to receive additional resources, we're really not going to see very clear specificity about what schools are required to do in that kind of an effort. In my view, the only option we have for accessing federal leverage is through an act that would perhaps being used through tort law, which is liability, that, it's dangerous to sit kids, it's dangerous for them to be sedentary, it's not good for the health, that we need to provide mechanisms that protect kids. And that would be the only avenue, I think, that we could really get at a provision that would require schools from a federal perspective to do something differently. With that, then, we're really left to working at the state level and, of course, the local education level or the school district level to really operate changes in schools. So advocacy is a never-ending process. It's not an event. It takes many, many, many years to make some of these things happen. But advocacy communication should make clear the practice change target, and it should remain consistent over time. I think as a profession, we haven't been very clear about that. That's maybe why we haven't been able to realize some of the changes even at the local level. There's more that's happening. Public health is really starting to gear up and work very hard on operating on school level policies to promote physical activity. But we also need really good research evidence to compel reasons why change is needed. So evidence does in fact matter to advocacy. But there are different aims of advocacy I really want to make us all aware of. First, one aim could be to change knowledge. My example about the principal who didn't know about their own practices in their own school. People have to understand what's going on and why what currently is going on is not okay, or what are the problems associated with that. We need to use data wherever we possibly can to do that, but that's one aim of advocacy. Once we get people to understand the problem, that there is a problem, then we have to work on changing value perspective. And that means that we want to try to use data or use communication strategies that are going to engender a personal and social and or financial investment in the cause. And hopefully we're targeting policymakers when we're trying to change their value perspective. But we can also be targeting coalition members who could serve as part of that coalition. And then policy change, being very explicit about what do we want the policy to do, specifically in relation to the practice, and then really working very hard over time to see that policy change. And that's a different kind of advocacy as well. And so, one of the things we've been doing in some of our research is trying to understand at the school level, how can we try to make influences with that school principal? And our research is really showing in that same study with 154 elementary schools from 34 states, principals told us that the PE teacher is the #1 influencer of how they inform their decisions. So one of the things we need to do, speaking of pedagogy, we need to make sure that our physical education teachers know how to interact with their principal and know how to advocate for their programs. So important. The district coordinators and other principals also influence principals, so that matters a lot. And let's not forget the superintendent who says we're going to do something, and that's in fact what we do in the district coordinator. Now at this level, if we're operating at the district level of the state government, these are different groups that we'd want to we would enlist into a coalition to help us leverage these kinds of changes. Organizations, voters, public health, medicine law, parents, students, and community members. But I want to diverge a little bit to say that we have to, I think, understand that when we advocate from a public health perspective, which I believe is our greatest leverage point to realize change in the number and the amount of PE classes that students get over the course of their K-12 experience, we have to start to recognize that we don't necessarily agree what physical education is and how it really, what the focus of the curricula ought to be within schools. And that, under our standards, there are a lot of things that could happen, and it could look very, very different for students. And so I believe that there are some internal barriers to changing our status. And recently I was asked to provide a position on the physical literacy. It's not so much the physical literacy piece that I'm concerned about, but as I began to review this, I learned that the national standards, the content standards for physical education, have really shifted. They've shifted to more cognitive outcomes versus the psychomotor or the actual doing part of physical education. One of the things is, students have to know about physical activity. Students have to know about fitness, not necessarily be physically active, not necessarily be physically fit. These are shifts away from the curriculum, I think, that don't help us in this advocacy arena if we're talking from a public health standpoint. So this is challenging for us, I think. So there's many, many advocacy research gaps. We need to know a lot more about what research evidence matters to different advocacy targets. One of the things that, in the many experiences I've had with the state legislature and the different states that I've lived in, folks really want to know how much physical education costs. They really want to know what are the short and long-term benefits. We don't really have that. We don't really have that data, and we really need it. But those evidence might be quite different for the school principal, and it might be quite different for some of the district level superintendent. So we have to know more about which evidence matters, and we have to know how to deliver that advocacy. Do we do it in face-to-face meetings? Do we do it making videos? Do we have case studies of students? What are the best ways to go about this? There is some interesting data that are coming out in other cause advocacy research where they're using champions, and our data would suggest those champions ought to be physical education teachers working very closely with the school principal, getting the training to do advocacy well. But leveraging people who can have influence over the policymaker is a really important strategy for us. I think we need to use it. But we need more data around these kinds of efforts. We don't know very much about the organizational structure of effective advocacy efforts, how to build coalitions, how to keep them strategic, how to keep them on time. And we don't know very much about the kinds of arguments that, different organizations may bring to the legislature that further compromise physical activity in schools. So for example, one of the things that we did recently is we did a study because we knew that there were lots and lots of different motivations on the part of other subject matter area to count as substitution for physical education. So junior ROTC is one of those, and across the country, it's one of the main ones that counts for a waiver for physical education. So in lieu of taking physical education, students take junior ROTC, and that's fine. They don't have to take PE. And the primary assumption that's being made from a lot of the legislative bodies who are looking at this policy is that, hey, junior ROTC is very active. Well, is it? So our data shows that, junior ROTC, which is in the dark purple, that students are sedentary 76% of the time. And in high school, we're at, in high school physical education, they're sedentary 40% of the time. And moderate to vigorous physical activity levels, only 24% of the time. It's this kind of evidence that when we can't answer with an evidence-based argument, we put ourselves in a position to be, not being able to answer to antithesis to things that compromise, I think, some of the school physical activity programs. And so research really does matter. We need to know more about the right kind of research. We need a salient evidence base for it. And we need to know more about effective advocacy that can lead to policy development, enactment, or change. And so what research inspires investment and change? We need to know that, and we need to know it for the different policymakers. And I have to tell you, in the work that I've done, when we do national studies, it's great, but it's not as effective as local data. Local data matter in this kind of work. They want to know, especially state lawmakers, that you're talking about kids in their state that they have responsibility to. And that evidence that challenges assumptions is really needed, like the example I just gave you with the junior ROTC and high school physical education. And so for me, all of this stuff is about healthy, happy kids, and these are mine. And they're getting older, and so this is my daughter Tori, who's 25, and my son Payne, who's 13. And for me, I really need to acknowledge the Robert Wood Johnson Foundation Active Living Research, who's funded a lot of our work in this area, and some of the main collaborators I've worked with, Tom McKenzie, Shannon Mana, Jim Morrow, Nicole Smith, Hannah Thompson, and Jim Salas, and I'm very grateful to Jim Salas. And this is our recent children's book that Tom and I have written because we really want to try and promote physical activity across the lifespan, and we're starting with little people, and if you haven't seen it, we'd love to show you the book I Can Move. And thanks so much for listening.